US1 Radio News Time is 7:52. Morning Magazine with Bill Becker continues.
And joining us right now, we're pleased to have Scott Pridgen. He's the Executive Director of AIDS Help in Key West and Keys here. And he's joined us. Good morning, Scott.
Good morning, Bill. How are you?
Welcome to the Morning Magazine. A pleasure to have you here and to talk some about the great work that AIDS Help has done over the years in the Keys and Key West, where AIDS has certainly taken its toll, but things have changed over the years, haven't they?
We are now looking at the disease of people living with HIV/AIDS are no longer dying from the disease. They're living well into their senior years. So they're living longer with adherence to medications that are now available that weren't available then. So, you know, our clients are living longer, and we're having to change to catch up with that and look at new issues.
Mm-hmm. We've come, like you say, certainly a long way in the past 30 years since AIDS just really devastated the Key West community back in the early 1980s, mid-80s. It was, people were just dying left and right. Wonderful people. It was just a terrible time.
20, 30 years ago, if you were diagnosed with HIV/AIDS, your lifespan was less than 5 years. But now, you know, people living with the disease, we still have stigma issues associated with the disease. But for us here in the Keys, we're fortunate that we have such a caring community that we're able to address those issues as well. But again, AIDS Help is looking at the disease through a different lens. We're looking at one of the things we're currently doing is collaborating with the Health Department and Florida International University. For the next 5 years, we have an intern from the Public School of Health and Social Work to really look at the disease for Monroe County, how it is trending specifically for us here in the Keys. With the Health Department and FIU and this collaboration with AIDS Help, we'll actually really be able to look at disease and see where it's actually trending so that we can better fit resources as well as look at things that we shouldn't be spending money on. So, you know, we can take a step back and really look at how we can impact the disease. The main trend that we are seeing here is the aging population. Currently, we have about 325 clients. Out of that number, 52% are over the age of 50. Which is incredible. And within that number, we have 45 clients that are over the age of 60. So that is really the biggest trend that we are seeing is the aging into their senior years, and the agency is going to have to address that through housing. AIDS Help has always been a component for housing equals care, and we have over the years have had, built properties and maintained properties for people living with HIV/AIDS, as well as other chronic illnesses and other diseases as well. But we really are going to have to look at what we are going to do with assisted living, how we are going to take care of our clients who are aging into their senior years. That's probably the biggest trend.
You've gone beyond just referring patients to other agencies. You're more or less collaborating with a lot of these to help these people.
We are. I mentioned the Health Department. We have always been a partner with the Health Department over the years, but this year we have really looked at medical case management as a total picture in collaboration with what the doctors, nurses, and other folks are doing so that it can be a wraparound care so that everyone has the total picture. So by doing that, we have a quality assurance QC person, basically, that is shared by us in the Health Department to make sure that we're addressing all of these issues between the departments so that we're going beyond the brick and mortar of treatment. Health is out in the community, not behind walls. So we have to get out into the community and treat that as a team. And so the Health Department is a great collaborator with us on that, as well as the Rural Health Network Clinic. That is an amazing trend for us and a great collaboration where we're actually providing medical case management at Rural Health. So it's segueing us into other chronic illnesses.
Okay. Well, Scott, we appreciate you joining us. Scott Pridgen, Executive Director of AIDS Help, and your website is?
Our website is www.aidshelp.cc, and look for our annual report, which will be in this Friday's edition of The Citizen.
Have a great day.